I'm Mabel Jong, and this is continuing coverage of the World Healthcare Congress coming to you from Washington, D.C. WHCC 2017, and this is our last day of interviews. Thanks so much for joining us, and a special welcome to our viewers who are joining us via the live stream. In our studio this morning, Tom Hill, Vice President of Addiction and Recovery, National Council for Behavioral Health. Thank you, Tom, for stopping by.
Absolutely. Thanks for having me.
You're speaking on a panel today, and what are some of the issues that you'll be focusing on and the takeaways that you'll be leaving with attendees?
Well, I already spoke on the panel, and it was a really great panel talking about the current opioid epidemic and different factors and different strategies of ways to address it. So I want to let you know that I'm also a person in long-term recovery. So that means I haven't used alcohol and drugs for 25 years. And so I have a personal stake in this as well. And my personal life in recovery has really it attuned me for this career that I'm currently doing.
Absolutely.
So, important.
You bring to it a very, very unique perspective. And so when we're talking about opioid addiction and the growing epidemic, what are the signs that this is going to be a very long-term project?
Well, you know, addiction is very complicated, and the Surgeon General's report on facing addiction, alcohol, drugs, and health came out in 2016 in November, so just a little while ago, the former Surgeon General. And it's a really important report because it shows the science behind a new definition of addiction as a chronic brain disorder that involves, that can involve both recurrence and recovery. And so positioning it as a chronic condition the same as any other, the same as diabetes, the same as hypertension, heart disease, puts it in a category that we can look at it in a different way. The only difference is there's an element of stigma involved with addiction. And so, you know, people, the other thing about the Surgeon General's report, that it outwardly says that this is not, that it can happen to anybody, that it's not bad behavior or moral failing, that it is a chronic condition that, like I said, can happen to anybody and has happened to a lot of people through the opioid epidemic.
What is the National Council stance on more aggressive programs to address this growing problem?
Well, of course, we want more aggressive programs to address this problem, and we want sensible programs. So, you know, we're for, there's evidence behind medication-assisted treatment, either methadone or buprenorphine or naltrexone as a way to abate the symptoms. And we also promote, in addition to that, you need psychosocial supports. That's treatment as we know it. And also you need recovery supports, peer and other recovery supports, to do the recovery management piece and help people attain long-term recovery.
Okay.
So those three things we call the three-legged stool. And those are just a really important, sensible approach to helping people not only abate symptoms, but get back on their feet with all the supports they need to do that.
Okay. What about conversations with providers, perhaps, on their strategies in prescribing these kinds of medications, and maybe heading off what could potentially be a problem down the line?
Well, I think, you know what, with every crisis comes opportunities, right? So it's allowed us to talk about addiction in a whole new way. And so traditionally treatment dealt with addiction as an acute disorder and not a chronic disorder. So people would get a very short period of treatment and then they would leave treatment and be told to avoid slippery people, places, and things, and you'll do fine. And people cycled right back into treatment, right? So there was a lot of relapse going on. And so what we've tried to address is how do you build a whole constellation, a continuum of supports from prevention to treatment to recovery in a way that makes sense and works. So a lot of treatment providers have had to sort of shift their thinking about how they approach treatment. And part of that has been medication, because medication wasn't always used very widely. It happens to be very, very effective with opioids in particular, but also with some other substances. But without medication, and again, it's like medication may not work for everybody, it's a personal choice, but for a lot of people it works. And getting the symptoms abated is the first step in terms of helping people get not only in remission, but on the road to recovery.
But how about also talking to providers about maybe perhaps rethinking their strategies on prescribing the opioid medications in the first place?
So those would be your primary care providers. Well, you know, the CDC has guidelines, and they went out last year also about how to prescribe opioids in a pain management system, but also in a way that addresses head-on overprescribing and steering patients toward a life of addiction that they may not be prepared for. And so I think, you know, we have some things in place now that I think can help physicians, and you have states that are modeling those guidelines in a way that I think is helping us rethink what pain management looks like. I don't think anybody's saying that for a cancer patient or a hospice patient that they'd be denied those medications, but maybe they don't maybe there's alternatives that could help folks manage their pain. And also maybe, you know, it's like what's the threshold of pain management, right? We don't have to go overboard in the way that we have in the last 20 years.
Absolutely. Tom, are there other things you want to leave with our attendees this conference?
Well, you know, I want to go back to what I said initially. I think, you know, the one thing we've learned about the opioid epidemic is that it can and does happen to anyone. It happens to us, it happens to our family members, it happens to our neighbors. And the other thing I just want to leave us with is that this is a very serious epidemic. People are dying.
Yes.
People are dying in numbers that we've never seen before, and the numbers are increasing. And I think that there's a sense of urgency there that we've never really had before, and I think it's a great lens to look at in terms of if we can address opioids, how are we going to address alcohol, marijuana, all these other substances that people also become addicted to? Because it's not just opioids.
Right.
That's just what's in front of us in the current moment.
Okay.
So. But I think going back to it's not a moral failing, but it's a chronic manageable brain disorder is a very different way of looking at it. And the more we can raise that stigma and raise discrimination for people that are facing barriers to recovery, that's the major part of our battle.
Absolutely. And are you enjoying the conference so
I'm
far?
enjoying it so much. This is so wonderful to have all these smart people together talking about these issues that really matter. Yeah.
Okay. Tom Hill, thank you so much
thank
for
you
your
so
time.
much.
Thank you.
Really, really appreciate it.
And thank you for joining us. Stay tuned. We have a conversation coming up with Independence Blue Cross.